So, Michael, how has been your day today?
Hi Raju. According to my agenda, it was supposed to be light, but turned out to be very busy. So it's a little bit like our topic today. So local scleroderma is affecting an organ that we see with our eyes. So it would be easy to look at disease activity. But in my experience, it's very difficult, even with the help of our dermatologist, to know how active are lesions of local scleroderma. So sometimes we take pictures on each visit, and then it can help to monitor the extent of the lesions.
Yes, Michael, but it also becomes quite difficult to judge the grade of skin inflammation. And we have exactly the same problem. And in fact, there is an issue that there are different shades of skin color that we see in our country, and that makes it also quite difficult to do this. And when we try and take pictures, what we realize is that maybe last time the camera was different, the lighting was different, the angle we took it from was from different, and therefore you never get proper reproducibility.
Yes, right, Raju. And in Geneva, we had the chance to have a professional photograph in the dermatology department, and it could really help. But anyway, a good evaluation of skin inflammation is crucial for the treatment monitoring, since we are using immunomodulators. So we might think that this is a benign disease affecting only the skin, but local scleroderma has a strong physical and psychological impact on our young patients. I just recently saw a young lady with a linear morphea of the left arm. She was limited in the use of her left shoulder due to stiffness of the skin and needed months of physiotherapy to restore her mobility. And she was also very affected by the appearance of her arm and needed strong psychological support. So we could treat her with methotrexate that improves significantly the flexibility of her skin and also the movement of her shoulder. But for us, it was very difficult during the treatment to evaluate the activity of the disease on objective criteria.
Absolutely. And if especially this is a disease like Encoupe de Sabre or Paris-Romberg syndrome, the cosmetic effects can be really devastating. And Michael, objective assessment of skin inflammation, besides for day-to-day care of these children, is also necessary for randomized clinical trials which evaluate the efficacy of DMARDs we use to treat patients. Currently, there are no FDA approved treatments for localized scleroderma, although consensus based groups have started compiling evidence across clinical sites.
True, Raju, and recent attempts at meta-analysis have been unsuccessful due to wide variation in how successful treatment efficacy has been defined across studies, clinics, and registries. And so I came across a recent review that explored the measures used to evaluate treatment's efficacy in local scleroderma in children and adults, but there was a special focus on pediatric data.
So this is the study which selected 168 articles for their systematic review and meta-analysis according to the PRISMA guidelines. And different types of clinical outcome and assessment were reported.
Yes, it's interesting to see the diversity. But the most reported type was a clinical assessment of treatment outcomes, including formal and informal evaluation by clinicians. New lesions, the size of the lesions, moderate or severe erythema, violaceous lesions in duration. But some studies evaluated clinician-reported outcome measures, like the low SCAT, for example. And patient-reported outcome measures were reported in only 26% of the studies. And additionally, the use of external equipment was also reported. For example, MRI was used to evaluate the depth and the thickness of soft tissue and inflammation and edema of the lesions. And thermography, ultrasound, and photographies were also used. So it's a very wide use of different outcome measures.
So, Michael, what was your key take home message from this review?
So first, we need urgently more evidence in this field, and in particular, randomized controlled trials to confirm that our treatments are really targeting the needs of our patients. And so prompts, so patient-reported outcome measure are here very important. And we should not forget that we are treating a disease that is not endangering the patient, and we treat them with potentially toxic medications. So to be able to do these studies, which are very important for us, we need validated outcome measures. And you, Raju, what did you learn?
No, exactly what you say, because I don't want the patients to be saying that cured yesterday of my disease, I died last night of my physician. And I too tell them as soon as I start treatment that do understand that the treatment we use will definitely help to arrest your disease and prevent it from progressing, but do not be sure that it will reverse what has already happened. And I too monitor them with photographs, but I'm very, very careful because data privacy can be an issue when you are storing pictures on a computer, and especially if this belongs to the swimsuit area in children.
I totally agree with you, Raju, because the important point is to really good inform the patient that we will not remove the lesions, but we can stop their evolution. But on my side, I really will continue to treat and evaluate my patients similarly. But for the scientific community, there is here a lot of work to be done.
Very, very true. And as we leave today's discussion, I will just tell you one important point, Michael, and that is that last year I had met Professor Suzanne Lee from Hackensack University, and she has created a small little album. It's not more than 20 odd pages and it'll fit into your palm, and she's got a bunch of pictures in that which show what an active lesion looks like and what a healed lesion looks like. A color album, but this album is mainly for fair skinned individuals. But it's good if somebody reached out to her. I'm sure she would part with a copy.
Very good idea. Thank you very much for reporting this and see you next week. Bye bye, Raju.
Bye.